Thanks for tuning in to an Academy of International Mobile Healthcare Integration webinar. To ask questions, please use the Q&A function in Zoom represented by the double dialog bubble button. The chat function will be disabled for participants. This webinar is being recorded and will be available for on-demand playback on the AIMHI website tomorrow. The slide deck PDF will be included on the website as well and will be posted to the chat shortly. Although this is a primarily discussion webinar, so the deck does not contain any significant content. AIMHI President Chip Decker, will you please share some information about the association?
Chip, you're on mute, sir.
Thanks.
Starting off with a bang there, buddy.
I know. I was trying to figure out, does Amanda do that every time, or is that a recording? But anyhow, thanks, Amanda. So the Academy of International Mobile Healthcare Integration, or AIMHI, represents high-performance, high-value EMS providers in the U.S., Canada, and beyond. Member organizations are high-performance systems that employ business practices from both the public and private sectors. By combining industry innovation with close government oversight, AIMHI affiliates are able to offer unsurpassed service excellence and cost efficiency. To learn more about AIMHI, join today and take a look at our website, aimhi.mobi.
All right. Well, thanks, Chip. That was very well done. And for those of you that hadn't noticed, the aimhi.mobi, very appropriate. We can thank Rob Lawrence for that and the rest of the board members when we were trying to go through that process. So we're pretty excited about that. Okay, so I'm going to have the honor of hosting this band of leaders here with us. So why don't we start by folks explaining to us about your systems. And I'm just going to go in order that you appear in the Hollywood squares here. And it'll be Ken, then Chip, and then Joel. And then we'll mix up that order. But Ken, why don't you start telling us about Medstar and about the system?
Excellent. Good morning. I'm Ken Simpson. I'm the CEO here at Medstar Mobile Healthcare in Fort Worth, Texas. We provide emergency and non-emergency care to the citizens of Fort Worth and 13 surrounding cities, as well as mobile integrated healthcare as well. So,
Chip.
So, my name is Chip Decker. I'm the CEO of the Richmond Ambulance Authority, Richmond, Virginia. And Richmond Ambulance Authority was created in 1991 to ensure equitable service to all parts of the city. We are a self-operated public utility model. We parted ways with our contractor in 2007. We're not a large area, only 62.5 square miles, but we run about 50,000 calls a year. We do both 911 and non-emergency transport, and our annual subsidy is about 24% and is required for us to be financially sound.
Hi. And I'm Joel Benz. I'm the executive director of Three Rivers Ambulance Authority, which is located in Fort Wayne, Indiana. We are one of the larger counties. We are the largest county in Indiana. We are the 82nd largest city in the United States, Fort Wayne. So we're a fairly busy system. We have operated for 40 some years as a public utility model up until about a year and a half ago, and we transitioned to operating ourselves. And so that's been a massive change for us to undertake during the last, pretty relatively recent history. So.
And Joel, before you started that transition, you had a full head of hair, right?
Yeah, it was a full afro. Yep.
All right, and thank you guys for the introductions. And you've all been through some interesting times, like many EMS agencies across the country. And Chip, let's start with Richmond. So the Richmond Ambulance Authority has been publicly funded for a long time. You can explain why to the participants. But how has that changed recently and some of the current dynamics going on within the city and the Ambulance Authority?
So we have been partially funded by the city of Richmond ever since we were created back in 1991. And there's several reasons for that. One is the true tenets of the public utility model, you have to have a certain amount of population, and you have to have a good enough payer mix. And our payer mix is not all that exciting. 75%, are federal programs, with 32% being Medicaid, 12% are self-pay, and insurance. What everybody likes to bill, insurance. I think your Anthems and your Aetnas and whatnots are only 8% of the transports that we do. And so that's why it's difficult for us to make an impact on our revenue by raising rates, because Medicare doesn't care. Medicaid, they really don't care. The self-pay people, they're probably self-pay for a reason, and they're not going to pay either way. And so it comes down to this 8% of insurance, people with private insurance, that really care about what our rates are. So we have had to rely on the city every year. And as administrations change, as the city council changes, you just have to stay on top of all the new people coming in. For example, Richmond has a strong mayoral system. And so what that means is the mayor is elected and prepares our budget and gives the budget to city council. City council then looks at that budget and decides if any changes need to be made. And if any changes need to be made, then city council has to take it from somewhere else to move it to the place that they want it to go. And that's difficult once a budget's already done. So if I get underfunded, and then, where are they going to take it from? Because we're all vying for the same bucket of money, from the city tax revenue. So we've had to do several different things here lately, because there's a new sheriff in town, not literally, but figuratively, and their intent is to make the ambulance authority as self-sufficient as possible. Well, we just don't have the payer mix, in order to be able to do that. So there's a couple of things that we've been forced into doing. Like, we used to purchase our own capital equipment, and now we've had to go to leasing. And while that helps initially, eventually it costs more to do that. Cash is still king. It's just a matter of, being able to have what you need in the bank to pay for it. And so the last few years, the challenge has been is that the administration chose to have us spend down our capital funds that we would have spent to buy ambulances or heart monitors or whatnot. So the ambulance authority is not a city department. We're an authority. Think of an authority as when, a government wants to outsource something and they create an authority. And so just like economic development authority or the housing authority here, I don't work for the mayor. And so that makes us a lot more agile. I don't have to work at the speed of city. And so the mayor this year presented a budget that was actually fairly favorable to us. And it's all about making those relationships, getting in front of where the train is going, and knowing, having the votes, knowing how people are going to vote.
Counting noses.
Counting noses, absolutely. So, and so yeah, that's kind of how we've been working. Since we've had every year, we have to go back and hold our hand out.
And that's different for Medstar and Three Rivers, right? Ken and Joel, you guys were self-sufficient for a period of time, but then to meet what happened over the last couple of years, and what was the tipping point for you guys to have that conversation in your local communities?
You want to go first, Joel?
Sure, I can go first. Yeah, so TRA has been actually self-sufficient for 40 some years. They initially provided some seed money way back in the 80s to get us off and rolling. And then since then we've been able to, and it's interesting, Chip said his payer mix is 75%, mine is 85% Medicare, Medicaid. So even a smaller piece of the pie I'm trying to work off of. But over the last few years, we had a contractor and they really just, struggled with retaining staffing. And so we got into a situation for a variety of factors. I think everybody that's probably watching this is well aware that, EMS has been kind of underpaid and people have transitioned through it. We have a high turnover rate. And so those factors just kind of all combined. And so we really got to the point where our metrics weren't being met, and that was really driven by the staffing issue. And so the city and myself decided that it was time to make some changes. Some of the elected officials got really vocal and, hey, we're going to change course here. Something needs to happen. The former executive director resigned. They brought me in. That was about 2.5 years ago. And so then from that period on, we started looking at what can we do? How can we make this place sustainable? And one of the things, so about 1.5 years ago, I said we transitioned away from our contractor. At that same time, we increased wages and benefits across the board for our field staff about 40%, which was a hefty hit. And so without having a contractor in place who had a hedge fund that owned them with a pretty large pool to draw from, we essentially went to being our own organization, which we had some funds on hand, but we also knew that those would get run through fairly quickly and we would need some backing from the city. And so kind of to back up, we went to the city ahead of time and said, are you going to support this? And they were willing to be on board. They felt like it was the right decision also. And we did a number of things to kind of get us to that point, but really that was the tipping point. Once we went on our own, we knew we needed to have some kind of outside support, some external help, and the city. And we also went to the county, which is another kind of whole story in and of itself.
We're going to get to that multi-jurisdictional thing in a second. Ken, how about at Medstar?
Yeah. So much like Joel, we kind of went through COVID. As we went through COVID, we saw, like everybody did, a lot of expenses increasing pretty significantly, from medical supplies to ambulances. We had actually contracts worked out for the purchase of new ambulances, and they wanted to go up 15% on our purchase price. So we told them no, that we weren't going to do that, and really it just slowed the ambulance purchase down. So we were kind of left with no choice other than to buy from the market. Likewise, we made the decision that we would offer pay increases to try to help retain people and attract people, because the system kept getting busier. So we gave pretty significant pay raises over a couple of year period there through COVID, and we were able to attract and retain more people than we had been previously. Excuse me. And so, as we went through that, we also borrowed to purchase some of the ambulances to try to preserve cash. We had some capital expenses that we just had to make, like stretcher replacement and whatnot. And it became pretty evident that it was not going to be sustainable in the long run. We even did rate increases about 4 years ago for the first time in 10 years, I think it was. So because Medstar is I didn't mention this earlier, but Medstar is also self-operated, and we had not received any public funding since about 2008. So we were able to generate a little bit of extra revenue with with the rate increases, and our billing and finance team has done a tremendous job working with organization that does billing for us, an outsourced organization, and they were able to maximize some revenue there. But again, we were still going to come up short. So we started having conversations with the in detail with the city probably back in 2020, I would say. Since 2018, 2019, we had let them know that the expense and revenue lines were likely going to cross. And so the city of Fort Worth specifically, and then some of the suburban cities, we kind of dove into things that we had been donating. And there were a couple opportunities there, or appear to be a couple opportunities there, for things that are either county responsibility or city responsibility. And so we were able to contract for those to push it out a little bit longer. And actually our conversation about the need for public funding and how much it'll be and what structure that'll come in is still ongoing. So, but that was kind of the tipping point, really, is all the expense increases and the labor increases, and trying to make sure that our folks were taken care of. We've held their benefits costs, their insurance costs at the same rate for probably over a decade. But you know, it's just getting more expensive, and reimbursement is not improving. And Texas is not a not a Medicaid expansion state. So about 25% of the folks that we pick up don't have a payer source. So that also creates challenges for us. But because of those things, that led into the discussion that we've been having with the city of Fort Worth and our suburban cities about what the future looks like.
Thanks, Ken. Joel, you alluded to it earlier, but it's not just one city that you were talking to, a city, county, others. How did that work from a funding perspective?
It created challenges. The city felt like they wanted, because we cover the city and parts of the county, they were like, well, if we're going to give you funding, we want you to go to the city or to the county also and request funding from them. And the county was very resistant to providing any sort of funding. They really chose their own path. And so rather than, prior to kind of this whole situation, we were the primary ALS provider for the majority of the county. And so they chose to start building up, transitioning volunteer fire departments to full-time paid staffed career departments. And so that was kind of the county's approach to solving this, which sort of diluted the pool then of available resources and paramedics and EMTs, and made it more of a challenge. And a lot of my folks kind of transitioned to those because they put almost 2 times my annual budget into that through raising taxes, which was really unique. And that's just for the county. So the city I'm still operating in, now has, not only competition in the market for resources, but, taxes have been raised substantially outside the county. And so it's restricted my coverage area a little bit. But it's led to some real challenges. And then not only from a financial standpoint, but also operationally, trying to work with all these new players. So did that give you enough depth there, or you want me to dig it a little?
So is it just Fort Wayne that is providing you with that cost offset?
Correct. The city. Yeah. Although there are some things that the county has provided. So we did end up covering one of the townships before that is now paying us directly as a subsidy. So we were initially kind of like, okay, let's talk to the county, as a whole, because there's a structure, county commissioners and county council, and they were pretty resistant. But then when we kind of got down below that level, we found some people who were like, we like what you're doing. We don't want to change. We don't want to be involved in these fire districts. And so they were willing to pay us directly.
Okay, good. And Ken, you also serve multiple jurisdictions, and the experience that you've gone through and that the organization's gone through over the last several months has been interesting. How has the community responded? What what has been the other jurisdictions? What's that interaction? What's that dynamic like when you've got 14 different parents that you need to talk to?
Obviously everybody has different dynamics. So a little bit about our service area. It is between 450 and 500 square miles. So it's one of the larger ones. We answer somewhere around 190,000 calls a year. 90% of that is Fort Worth, and the other 10% is divided among the other 13 suburban cities, which Fort Worth is contiguous with all of them. And so as we've gone through this process, as an example, in 2020, when we were talking about rate increases, and we talked about them with the board, some of the cities had questions. So of course, we spent time, we sat down with the city of Fort Worth and the city manager's office there. And then we basically made sure that we did outreach to all of our member cities, offered the opportunity to sit down and talk. There were probably 3 or 4 additional ones. When we explained to them what we were looking at, why the money was going where it was going, why there was a shortage, the resounding response was, you haven't increased rates in 10 years. The rates of everything else have gone up significantly. You're slightly below market. Please go ahead and increase the rates, because that makes sense. And so that's what we did. I think one of the things that, especially in public utility models like we're in, is it works well because we're subject matter experts. We handle EMS response and interfacing with first responders and working together as a system and answering the needs of the community. The challenge with that is from a municipality perspective, there isn't as much ongoing attention into where the dollars are being spent and things like that. So you have to remember, when you go reach out to, especially with multiple stakeholders and things like that, having that conversation and understanding that you've been living this on a day-to-day basis, but the municipality, it may be news to them, or it may be something that they hear once or twice a year. So you kind of have to go through and re-explain and explain where the dollars are going and why there's a shortage all of a sudden. And so that's been some of the challenge. The hospitals, likewise, in our market, the hospitals know that they pay a higher amount than the free market, and so having that conversation with them as well. That's how the system is set up. The non-emergency has really helped fund the emergency side, but you can imagine when you start talking about rate increases and things like that, that our hospital partners become a little bit concerned because they're already paying more than free market. So really just being responsive to that and understanding and figuring out how you can come up with a compromise. Overall, we found most people were pretty understanding when it came to the rates. As we talk about the need for public funding going forward, people understand it, and there's been a desire to sort of take a deeper dive into the why and what options are available. So that's kind of where we sit currently.
Okay, thanks, Chip. Let's go back to you for a second. What processes do you use and relationships that have you developed that helps keep the funder, the city, knowledgeable on what your funding needs are, and how do you maintain those relationships?
So it's important to be visible. You always have to be out there, whether it's city council meetings. I mean, city council meetings, if you show up early, everybody does their part, and next thing you know, I'm the only one sitting there because everybody's finished and the meeting's still going on. So I have an opportunity at the beginning and at the end of the meeting, maybe to chat with somebody. And each city council person has a district, and we go to their district meetings and do our dog and pony show, talk about, gee whiz, to call an ambulance is expensive now. And so don't call us if you don't need us, but call us if you do need us. And so we're educating the city council folks as well as the administration. Now, a key part of this is to understand how to get access to your city council folks. Who's the gatekeeper? And every council person here in Richmond has liaisons. And so those are the people you need to make sure know you. Because if you want access to the council person, okay, you need to take that liaison out to lunch. And yeah, that has been incredibly helpful because they get left out a lot. And if you treat them well, yeah, you can get the access. We participate in every work group, task force, whatever. I've lost count of how many, whether it was a COVID task force or, or it's, an overdose task force. And then we provide data. And so we create heat maps. Where are the drug overdoses? And so we then become relevant in the conversation that we're having. So yeah, with any way to participate in work groups, task forces, whatever that we do, and always have something in your pocket if you get called upon for an impromptu, the TV shows up, and you need to always have something in your pocket for a news story if you're, say that particular reporter's story falls through. And so we reach out to all the news outlets and say, hey, if you ever need something, we've got something for you if you just walk up and do it. Because yeah, you really don't want to establish those relationships when something has not gone as according to plan. And be honest. I mean, I'm always saying, yeah, we're understaffed. Yep, it's hard. We're under pressure to perform. Yeah, you're going to have to wait. The people who are dying are going to get service first, and so, yeah, that is the message right now, is that we're going to do our very best, but it's not like it used to be. And so we're trying to reset the expectation the public has. And so one of the best hires I did was hiring a PIO, public relations person. That is essential to success. I don't care what you're doing, because in our case, I hired a former TV news reporter. So he knows exactly what makes those people tick, what they're going to ask for, what you should say, what you shouldn't say, doing it very best to make sure I don't say something silly. They'll have to walk back. But, and so he monitors all our social media for anything that might be going sideways, any kind of conversation on any of our pages. But he also makes sure that our message is consistent, because we have so much data, and let's say we have to pick a point in time. If we're working budget, trying to explain, what we do, how we do it, how much it costs to city council, the media, whoever it is that we need to pick a point in time, and that data right there is what we're going to use for this whole narrative. You can't change it, because if you say, oh yeah, it's going to cost me, $10 million to do this, and then a week later, oh, it's going to cost me $12 million to do this, that's where you get jacked up on the TV and on the news, is because your message wasn't consistent. So be out there. Whenever we have a new council person, we invite them out, give them the nickel tour, and invite their liaison, invite the gatekeeper. It's essential to be able to walk through the door and just be honest. I mean, you can't duck. The reality is there. It's not EMS like it used to be. EMS has gotten hard. The service has gotten hard to provide. And because I don't know what happened to all people. But yeah, you just got to get your face out there.
How many ice cream socials do you go to a month, Chip?
Oh my goodness. Well, tonight I'm going to a district meeting and doing a dog and pony show. I got a couple of neighborhood meetings to do. And, you know, that's when you really get the one-on-one. But yes, I go to ice cream socials if the council person is doing it, and I will throw an ambulance right there sitting with me, with people that know how to be nice on it.
Thanks, Chip. Joel, and we're gonna ask everybody this. We'll do Joel, Ken, and then Chip. But so how are you guys engaging with the community to have this conversation, and what role, if any, has the media played in carrying some of that messaging for you? And we'll start with Joel.
Yeah, one of the real key things I think as we started kind of rolling out this process was I brought in, or the board actually partnered with the city to bring in a consultant. And I don't think this is the answer for everybody, but this worked really well for us. And that consultant came in and we were the ones to pay them, you know, which I think is key. So when we started looking down, we looked at a lot of different options, you know, and we basically said, you know, we're going to put all our cards on the table and be real transparent and look at, do we want to switch models? Do we want, this was before we moved on from the contractor. Do we want to keep the contractor? Do we want to become self-operated? We really spent some time and effort digging down in that. And a lot of things came to light as a result of that, including really what our ask was, which was about 3 million, which is about 20% of my operating budget annually. And so that helped us to start the process. It started, you know, they were able to interact with the kind of officials, you know, and then once we got that, we started approaching public officials kind of individually and collectively. One of the mistakes that I made that I felt would be important to share was when in the process of bringing in the consultant, we got together stakeholders and had meetings with all of them. But one of the groups of stakeholders, they were already sort of predisposed. This was the county commissioners, and they decided to go a different direction and start building those districts, those fire districts. But because they didn't feel heard and included, they came late to the meeting. They left early. And so the consultant in that time period was really trying to just jam information in rather than listening. And if I had that to do over again, I would have made sure that they felt like that their needs were heard and addressed. And I think maybe it would have impacted the outcome. So that was one of the, that is one of the real lessons that I learned, is that even when you talk to people, you still have to make sure that they feel like they're being heard, you know. And then my background is I spent about 7 years as an elected official. So I already knew a lot of the intricacies and how things worked. And so that gave me a leg up. But from that time, I knew that being the first person, the first actor, the first person in somebody's ear is highly effective. A lot of times as an elected official, the first thing you hear, you're like, that sets the bar. And then you are basically gauging everything that comes in after that, all the information that comes in after that, off of that bar. Is this true? Is this not true? What do I think compared to what I already know? And so being an early actor, getting really good information early on, really, really important. You know, the other thing that I think kind of has come out of this process. So, if you ever want to be an elected official, one of the things that's really good to know is that it takes about, this is scientific data, 7 times of contact in order to get a person's vote. And whether that's, you know, seeing you on TV in that scenario, or you knock on their door and shake their hand, the same exact thing applies in this process. You know, you think you talk to somebody one time and they get the message. That is not accurate. They get part of the message, and the part that they get might not be the part that you want them to hear. And it also, they may get another part and get it twisted around, and all of a sudden they're off and running and they've got not good information. So repeatedly oversharing actually, it really, really important to getting kind of where we've gotten, and a couple other things that as we kind of, move the conversation along, Chip had this exactly right. He talked about the people who have access everywhere in the elected official world. All of those relationships are really intertwined, and it may not be the same dynamic that Chip had, but there is almost always someone who is influential to an elected official, and a lot of times multiple people. And if they hear something from that person that they trust, they take that as truth. So getting to the ancillary people, kind of oversharing with them, and then having them reinforce what you're trying to share and say. And a lot of times, like Chip said, those folks are neglected, or they just, they're not the power mover. You have to know when you go into this who the power movers are, right? But knowing the ancillary people around them to be able to impact them and influence them, really, really valuable. And so building, I don't go to ice cream socials like Chip, but I go to political events. I go to, all sorts of events where I know there's a probability that I'm going to run into those folks or ancillary folks that, I can talk to, have a conversation, give an update. We're in the news a lot because of all this transition, and people are interested. They want to know, how you doing? What's going on? And that just opens the door, and then you just tell them. And, you don't have to be, you don't have to cover things up. You can be truthful and just say, here's where we're going. Here's why we need this, and we are doing our best, and we've made these steps, and we're headed in the right direction. And that's been extremely effective. Yeah. And to echo Chip again, having really solid data is vital. I ran into a thing where I provided some data and other people provided the same data. It was the amount of time. So we got into this situation where we're calling those county resources into the city to help us backfill. And of course, that creates a giant bunch of drama. And so they were reporting every time they got toned out. And sometimes they would do it. They had a 4-minute protocol. They would, send the next guy, so eventually they send someone, and they're counting every one of those. So I was like, well, every time we get disregarded, I'm going to send the exact same data so that, when people look at it, they can marry it up. Well, then people are like, oh, you're sending information where you're not even really responding to all these runs, so your numbers are inflated. And I was like, well, that's sort of true, but this is why, and then once I got that out, people kind of understood. But for a while, it was really taken the wrong way. And they're like, oh, you're just trying to inflate your data. So I would say be very clear with whatever data that you're handing over. And I think those are the things that I would say as a former elected official, I would look for, is those little inconsistencies. And when I find that, I'm like, aha. And so what I did to rectify it was I went to those elected officials that I knew had looked at that and were like, oh, this is fake. And I said, that was my bad. I was trying to do this. That's why you got the incorrect data. And it really healed that relationship. And if I hadn't done that, I think we would have been, really shut out. The door would have been shut. And then you asked about media, Matt. The media was really good to us. They saw what we were doing here, and they knew there was a story. Media people are, all they're looking for is a story for the most part. And so when they see something happening that's big, they're right there. And some people are digging to find stuff that's, not right, and expose a story, or something like that. But there are good people in that group. And they're the ones that kind of, after, you do the, have the TV lights shut off, they kind of just ask you a few more questions. And I built a relationship with one of the media guys, and he has been really instrumental through that. And, now he gets mad at me if, we have something. He's like, and he'll text me. He's like, is this really a story today? All the time. And then we had another lady, a sweet elderly lady that comes to every single one of our board meetings and spends, I always end up giving her a lot of time afterwards, but she has written us the most gracious stories because she's taken the time to really dig in and understand what's going on. And so my, I guess, piece of that would be, there are people that are just there for the big story, but the ones that really matter and the ones that will help you with your narrative as you're trying to get this information out are the ones that just ask the little extra questions and, man, key in on them. So,
Ken, what's been your experience?
I mean, they seem to cover it pretty well. The media has obviously been interested, as you know, Matt, and they've actually been pretty fair. I think as we have gone through this, we've also had a consultant that's been brought in to evaluate the ask, the organization, and the options moving forward, which is something that is reasonable and should really be expected, especially if you've gone from not needing any public funding to basically any sort of ask. Our team has been very open and honest, and in fairness, the consultant has verified a lot of the information that we shared previously. They've gone back and checked it and said, yes, that's it. Yes, this is correct, and so on and so forth. So that helps to build the credibility. To Joel's point, the media that's been following this, they want to know what the truth is, and we've been able to share that. We've also had conversations with the city of Fort Worth, because the city of Fort Worth is actually the one who hired the consultant, as far as communication and things like that. And so they've been able to get interviews from Medstar. They've been able to get interviews from the city of Fort Worth and that sort of stuff as they've gone along, which has been helpful. I'd say that, making sure you're spending time with those elected officials and with their support staff before something comes up is very important, because it does help build the relationships and build credibility, allows the opportunity for them to pick up the phone and make a phone call and say, hey, what's going on? Because again, when you get into these sort of situations, you sort of have to expect that it's going to be news to them. In the human nature, kind of the first question is to go, well, why now? What's changed? What's going on? Are you not using dollars appropriately? That kind of stuff. The same way with the response times and things like that. And just being honest about where we are and what we're doing to try to overcome it in the progress. And we've done that throughout. We're starting to pull back the last 2 months. Excuse me. The last 2 months, we've been able to achieve our response times. And through COVID, like the rest of the country, we saw cardiac arrest survival rates drop. Some of the rest of the country, theirs came up and ours didn't. So our Office of the Medical Director has done a tremendous job in working with the first responders and working with Medstar, and we're seeing those trend up as well. So those are things that people pay attention to. And like I said, just basically being honest and taking the time when there's not an issue to build the relationships. And Chip's exactly right. Treat everybody with respect and dignity, and they tend to be appreciative of that, and it opens doors for you.
And I think all you guys have done a really good job with, going to Rotary Club meetings and HOA meetings, and really anybody who wants information, the answer is always yes. And, what time and where. So that really helps quite a bit. All right. For Chip and Joel, and Joel, we'll start with you first. Going into a situation where you weren't getting a cost offset from the city to needing a cost offset, it's typical that a city or a county, and for those folks that are participating on the webinar and listening, that someone's going to want, hey, let's get somebody in here, kick the tires a little bit. And is this the right system? Is this, are we the right model? Is the current system as efficient as it could be? What was that process like for you, Joel and Chip, as you went through the ask or the increasing ask for cost offset?
Yeah, Chip, you want to go first?
Oh, absolutely. So yeah, as the city was looking at the ambulance authority, trying to figure out how we could become more self-sufficient, they hired some consultants, just like what the other folks have been talking about. In fact, they hired 3 to look at different aspects of our organization. And so since the city hired them, I considered it the city's consultant. So, oh, we're doing this because the city says we need to make these changes. So what were those changes? Last June, we tripled our rates. So that was something to talk about, because that made the news. And we added in a response fee. So if we go and provide a service and you don't go to the hospital, we're going to charge you for it. Not working, but we're doing it anyway. We adjusted our response time targets, and so and moved from all right, you're always going to get what you want to, all right, you're going to get what you need, and then we'll get to what you want. And so there was a lot of narrative that needed to go. There's a lot of change in culture that needed to be addressed. And how did we do that? Well, the good thing is administration was on board with our changes because it was their consultant. The city council was on board with the changes because, okay, it was the city's consultant. And so I went, okay, this is where we're going. And so I didn't get any pushback from the elected officials or the administration. Now I just had to sell the community. And what did we do? We sent out letters to all the facilities. We sent letters out to our loyal customers, those that use us a lot, to say, hey, this is coming. You may want to rethink, if you're just calling us to whatever, when you don't really need an ambulance. And so, yeah, the narrative is now that ambulances are expensive and may not be the appropriate way for you to go get dinner. So the top 2 pieces of advice: you need to have a plan. You need to figure out what is the message or the top 3 things you're trying to get out there. And is it easy enough to understand? Can your audience understand it? That doesn't require a lot of calculation. Does it just make sense? Build trust with the stakeholders. We've talked about that. And you just, as the CEO here, you just have to remain open to doing things differently. So you have to embrace the change, and figure out, all right, that wasn't where I wasn't expecting that response. So now I need to address this. So you need to welcome the feedback, and let everybody talk, because it doesn't matter how many times I say it's going to get expensive, guys. They don't realize it until they're like, oh my goodness gracious, look at that bill. How am I going to pay that? And so we have a lot more payment plans now set up than we used to. And that's not helping my revenue much either. But so yes, build trust with your stakeholders, know what the votes are going to be before any vote is taken, and remain open to doing things differently. And don't just stand in the way of progress, even if you don't understand what the progress is, because if you stand there, you might get run over.
Great point. And Joel, so did they kick the tires at TRA? Did they, look and make sure that was the best investment of their funding? And then what are your 2 top pieces of advice? And then we'll ask the advice questions to Ken.
Yeah, well, that was definitely on the radar, and it still is kind of an active discussion, honestly, because there's a real dichotomy here. We've got, what has happened in the city. We looked at what are the costs, what would this do? Would it deliver at the end of the day a better service to the community? Because really my job is to provide a service, make sure that when someone is in need, that an ambulance shows up, right, and is able, and so there's a lot that goes into that. And so as we kind of dug down and said, if we integrate with the fire department that's here, which we have a a great fire department that we work well together with, would that be better for our citizens? And I think as we really looked into that, the costs were shockingly prohibitive. It would have doubled or tripled the cost to provide the same service. And the counties went the other direction and they did that. And they're seeing their costs rise substantially. And so that's becoming an interesting dynamic now because everybody's sort of starting to be like, whoa, what do we do? And, but the other dynamic of that is, if we would have changed, would the service have increased or improved for the citizens who were calling? And I think in the short term, there may have been a little bump, but I think that our elected officials were wise enough to listen to the consultants and listen to kind of eventually what my board felt out of that, and see that there is some level of, you've got two different organizations, they're responding, they both provide, an ALS level of service at some point. But there's a little bit of a rub there. And that little bit of a rub actually long-term provides a better service. And I think we were able to sell that idea really well. We had data that backed it up. We looked at other communities that had this exact same thing and went a different direction. And some of those were pretty disastrous. We looked at some other folks like Richmond that kind of went in the direction that we did here. And it continued to provide a successful level of service. And, kind of the interesting thing too, when you kind of dig down into this, it's all really boils around the idea of keeping your people and getting your staffing better. And when we started really looking down at the psychology of it, I'm going to generalize here and maybe I'm going to get out of step a little bit, but my personal opinion is a firefighter generally is somebody who wants to charge into a burning building and save a baby, right? And a medic, on the other hand, is someone who, really wants to sit beside somebody, hold their hand, make sure they get better. And those are really sort of two opposing psychological, deep down, low level things. And so when this person has to go over here and do this all the time, it burns them out and it really shortens their career or vice versa. And then also there was a component of when you're focusing purely on medicine that you end up with better outcomes, as we kind of dug into that. And so those things combined really convinced us with the, additional increases in cost, convinced us to kind of go on the course, supplement, increase our wages. And we're looking at another, potential wage increase here or something for the future. But it's just, the administration really felt pretty strongly about that. And actually, surprisingly, Fort Wayne's fire department administration, similarly, very strong feelings, which is kind of unusual in that industry. And then now, unfortunately, our longest tenured mayor passed away, and his funeral's tomorrow, or his burial's tomorrow. But so we may change our dynamics again, and I'll have to start this whole process over again. But the basis is there, right? And Chip said this earlier, and I hope that everybody kind of heard this throughout kind of our talk. But man, if I have one word, it's relationships. Build those relationships early, maintain those relationships, be the guy, be the expert. But relationships at the end of the day are what move the needle on for us for getting funding.
Good. Ken, top two pieces of advice for the 80 people that are on this webinar when they're gonna ask for funding.
I was just actually thinking the same thing Joel was. Start early in relationships. Start before you need funding. Like I said, you build your relationships, help people understand what's going on and why it's going on, why you exist, what you are, why you do what you do. This organization's done a pretty good job with that, to the point that even during elections, we invite folks over for what we call Medstar 101, and it's really just exactly that. And it's not who wins the election necessarily. It's if you file papers to run, we reach out and extend an invitation, building tour, all that those kind of pieces as well. So, and then the second part is, as you go through it, you have to be flexible and have to understand you're either asking for additional funding or new funding. And there are a lot of different ways that can manifest itself. And you're a subject matter expert, and sharing your opinion and thoughts and the facts behind why are totally okay. But you also have to be prepared if they decide to go a different direction or want you to try something a little bit different. You can't be the one who just stands there. And earlier we talked about trying to get in front of the train. When you get in front of the train, you don't want to stop, because they tend not to stop very well. So, but again, build a relationship, start early, and be flexible as you go through the conversation.
Excellent counsel. Thank you, Ken. And we want to thank our three panelists. Also want to remind you that this has been a webinar by Aim High about how to ask for the funding. We recently, depending on your point of view, did a webinar on how much funding do you need? And as we're going into budget times and fiscal crisis for many EMS agencies, go to Aim High's website, as Amanda said earlier, aimhigh.mobi, go under education, and you can watch the recording of the webinar that we did, How Much Funding Do You Need? It kind of walks you through that. We actually have some resources available for you if you need them to determine what some of your costs might be, and that would help you tell your story, because you'll have the data that you've heard these guys talk about throughout the entire webinar that you need to tell your story. So, and Ken, the Jets held off, right until the very end. So it sounds like the Blue Angels are up there. I'm going to turn the floor back over to our president, Chip Decker, for any closing thoughts and well wishes for the participants.
Thanks, Matt. Well, I appreciate everybody tuning in here, and I also like to thank the AAA American Ambulance Association for hosting this Aim High webinar. And hopefully you found something you can take away and use at your own agency. So thank you very much.
Thanks, Chip. And Amanda, any closing logistics for the participants, how to get the recording, the handout, etc.?
Absolutely. So the recording will be posted to the Aim High website by tomorrow, and we will also send it out in an email to all registrants. So please be patient. It just takes a little while for the YouTube video to cook.
Okay, and there are a couple of last minute questions coming in on chat. I think we've got, you may have all contact info. We do want to close on time for the folks that attended, but if you want to email us or email Amanda, reply to one of her invites or ours that we sent out, we're happy to circulate the question through the panelists to get an answer for you. So thank you all for being here.